Implants for dental purposes have been an increasingly popular option for those seeking to restore missing teeth. Implants are a long-lasting and natural alternative for dentures or bridges. However, are they the best choice for you? In this short video, we'll look at how to figure out if you're an ideal candidate for dental implants. 1. Teeth missing. One of the most evident signs that you could be an ideal candidate to receive dental implants is when you've got one or more missing teeth. Implants are made to substitute the root of teeth that are missing and offer solid foundations for the creation of artificial teeth. If you have lost your teeth because of injuries, decay, or gum infection, dental implants may be the best alternative for you. 2. Jawbone and gums that are healthy. To be able to support dental implants, it is essential to be healthy and have an elongated jawbone. Implants are surgically placed in the jawbone. Therefore, it's essential to ensure that the bone structure of your jaw is strong enough to hold implants. If you suffer from gum disease or weak jawbone, then you might require treatment prior to having dental implants. 3. Healthful overall. Implant surgery for dental implants is an uncomplicated surgical procedure. However, it requires general health to ensure a positive result. Heart diseases or immune problems could affect the body's capacity to recover after the procedure. Make sure you talk about the medical history of your dentist in order to determine whether you're healthy enough to undergo dental implants. 4. A commitment to maintaining your oral health. Implants in the mouth require frequent maintenance and treatment to prolong their life. It is important to floss and brush every day, and going to the dentist regularly for appointments and cleans. If you're committed to maintaining your dental health, you could be a suitable patient to receive dental implants. 5. Smokers and non-smokers. Smoking has adverse effects on the performance implant dentistry. Smoking may slow down healing and increase the chance of infection and could make the implant fail. If you smoke, you must stop before undergoing implants for your teeth to guarantee that you get the most effective result. 6. Expectations that are realistic. Finally, it is essential to be realistic when thinking about dental implants. Although they are a long-lasting and natural solution to missing teeth, they might not suit everyone. It's important to discuss your expectations and goals with your dentist in order to make sure you've made the best option for you. Dental implants offer a new method to replace missing teeth. However, they might not be appropriate for all. When you consider factors like the absence of teeth, the health of your jawbone and gums, general dental health, dedication to health, habits of smoking, as well as realistic expectations, you will be able to decide if you're suitable for implants. Make sure you consult your dentist about your options and decide on the most effective treatment strategy to meet your dental health requirements.